What is the most unique or difficult diagnosis that you can handle remotely?
I would probably say the challenging things would be where I need tools like an EKG or an ultrasound. So if you have a pregnant person having some concerns about their baby, having that mobile ultrasound there and being to telemedicine in with them, or if they're having cardiac chest pain and having that mobile EKG is a game changer. So these are like high risk medical cases that normally I would say get off the boat or call a helicopter. Now I could kind of manage with good insight and good accuracy having those tools available.
If one of your clients signs up for your longevity program and they're 50 years old, how many more years are they likely to enjoy on their yacht?
Oh my gosh, with the way technology and biohacking is going, I hope another 50 years. I hope to keep them sailing until they're 100.
What is the one thing you enjoy most as a concierge doctor?
I would say just being able to connect to my patients on a personal level outside the traditional like medical room or emergency room and getting to know them, being able to travel with them and just kind of being part of their family to that level of just knowing what every single person needs medically.
If you could buy any boat and had the time to enjoy it, what would you get?
Well, my dream is to kind of go and do the search, like what all surfers want to do. So I would like to be on a boat that is fast and safe and can get me to like remote islands in the South Pacific or anywhere where I could just find surf breaks that haven't been ridden before. That's my dream.
We're going to find you your boat. Welcome back to the Current Yachts podcast. Today, we're going to talk about the one thing that most boat owners don't plan for seriously enough, and that is what happens when someone gets seriously hurt or sick offshore or in a remote anchorage. So, Dr. Rez, welcome to the show.
Hi there. Thanks for having me.
You are a board certified emergency physician. You're the founder of this company called Modo MD in Maui, and
Correct.
someone who has built a practice around bringing serious medical care directly to patients
Mhm.
wherever they are while offering to the most customized experience to your patients. So, Dr. Rez, tell us about you and how a Cedar Sinai doctor ends up in Maui running a mobile medical practice.
Well, so much to talk about. First of all, thanks for having me. I love your show, and I've been very intrigued with all the good guests you've had, and I've been learning a lot about yachting and boating with all your guests. So I'm honored to be here.
Thank you.
Uh, so a little about me. I'm just a normal kid that grew up in LA surfing and just loving the ocean. And I got in a car accident is the reason I went into medicine on a surf trip in Cabo back in 1993. We got air rescued out and I realized how limited resources are when you're abroad. And so I tasted that firsthand. We got medevac. One of my best friends almost died. They almost amputated another guy's leg. One guy had a punctured lung. So a few of
Wow.
us spent a couple of days in the hospital. And I thought about what life is about. And I just wanted to surf, but I also wanted to help people. It's always been a passion of mine, but never believed in myself and going through the years of training that it takes to be a doctor. So I signed up for it. I became an EMT. I worked on an ambulance just to taste and feel medicine, injuries, blood, just to see I want to be around it.
Uh-huh.
And in undergrad, while I was at UCLA, I continued to work as an EMT, and it just kind of just strengthened my desire. But I gave being a marine biologist one chance, and I decided to sign up for the marine biology quarter at UCLA, which happened to be in Hawaii. So I spent 6 months in Hawaii, and the year that I signed up, they're like, "Sorry to tell you this, you have to buy your ticket to go to Morea." I'm like, "Morea, where is that?" Like, it's in Tahiti. I'm like, "That sounds great. What's the problem?" Like, to pay for your own ticket. So I'm like, "Sign me up." So UC Berkeley had a lab there. And that's how I had the aloha spirit and the Polynesian culture just show me how good lifestyles can be on the islands and the aloha and the fish and the sailing and the boating. And that's how I kind of got into that. I was one of the only students I was allowed to operate the boats during our marine bio research. So I did a lot of scientific diving, some real experience with snorkeling, free diving, and scuba diving, which comes in handy as an ER doc on the islands because you see these injuries coming in, dive
Mhm.
injury, aero trauma, and all those things. And after a while of working in the emerge and having a really good job after training at UCLA, at Cedar Sinai, I just kind of missed the islands and it had been 10 years. So I started flying back and forth and helping. And Maui became home overnight. It just was an island that needed good doctors. And I liked working night shifts and surfing and playing in the ocean during the days. And after a while, I kind of realized there's a big need for house calls and nobody was doing it. So I worked on bringing the traditional house call doctor back in present modern day world with modern technology. So I have a portable ultrasound that I've trained on how to use. I have a portable EKG. And at first, I did it for trade. I got coconuts and avocados, and I stitched up friends. And I got to buy malpractice. This is risky stuff. I'm putting a finger back. Everybody's your friend until something happens. You don't know.
Mhm.
So then I'm like,
True.
"Hey, about malpractice, would you pay?" And people were willing to pay, and they paid more. And then the Four Seasons asked me to help out because I took care of a couple of their like celebrity actors that called, and they gave me a room. And I told the ER, I'm going to take a sabbatical. I think I'm onto something. It's so fun because I learn so much when I go to patients' homes. I get to see what they're eating, where they live, what their risks are. You just, in the ER, you got 5, 10 minutes. You make
Yeah.
a decision, in or out, surgery or not surgery, home or stay. You got to make quick decisions. After 10, 15 years, you can only enjoy the feeling. There is no joy. It's just hiding the pain of like telling a wife that her husband drowned or a mom that her kid died. Just hearing those screams of families afterwards. I still get teared up thinking about it. So I kind of do emergency medicine in a small pulse. I'm still, very excited about adrenaline and helping and being there when someone's really critical. But I also like the wellness and longevity. And that's where I've moved my practice to. And after we got on that show, White Lotus, believe it or not, overnight, my company kind of took off. We helped HBO while
Wait
they're
a
filming.
minute. So hold on. You were the star of a show on HBO and you're now just telling our listeners this. So much to unpack. So tell us about this experience. And next, tell us how you got started into yachting after that. It sounds like this is pretty recent development from your side. And we met you actually on the docks at the Palm Beach Boat Show, which
Yes,
was just a very
amazing.
exciting encounter because I've never met a mobile doctor before. I don't think there's many others out
Yeah,
there that are offering what you offer. So
yeah.
let's start with White Lotus. What was that?
I don't really brag about it. Some of my marketing teams like you should. I don't know. I grew up in LA and Hollywood. Acting was always there. My friends did it and never did much for me. But I
It was a
gotta
no big deal thing for you.
Yeah, it just happened, and to this day, my friends will see the show, like, "How the heck did you get a line on that show and you never told us?" I've been trying to act my whole life. I'm like, "I'm just a lucky guy." But I took care of Mike White, who's a very talented, amazing, director, and after we left, I was like, "What are you filming?" And nobody knew. I didn't even know if the show was called White Lotus, and I was like, "Sounds like an interesting show." And then I was walking out with my nurse, and I'm like, "Hey, man, we're in the middle of COVID. I'm so tired of doing COVID tests and the stress of people trying to get on their flights and people sick from COVID." I go,
Oh.
"Give me a George Clooney moment if you ever have one. If you ever need a doc, call me." And my nurse goes, "You're so LA. You're so cheesy. I can't believe you asked them that." I'm like, "I was kidding." And while I'm in the elevator, literally the next day, I get a call. "What's your name? What's your chest size? What's your portfolio? Have you done any acting?" I'm like, "Who is this? Do you need your COVID result, lady?" She goes, "No, Mike White said you're on the show tomorrow. We fired the actor. What do you have? What are you going to say?" I'm like, "I don't know, but I'll show up." And I did. And I'm on the first season as the doctor, like in the White Lotus at the resort. So I helped deliver that baby when her water breaks and on another episode, like episode 5, season 1. So that's my little like 30 seconds to Hall of Fame. But that made us kind of get known about doing resort medicine and concierge medicine. And then I ended up opening a practice very close to the Four Seasons in Wailea. And
Mhm.
we high acuity urgent care, everything from shoulder dislocations to heart attacks to strokes, we'll diagnose in that clinic and help manage by sending them to the hospital, but we'll do everything else in between. And then since I went to West Palm Beach for a longevity anti-aging conference, we'll do everything from exosomes, stem cells, peptides, and just biohacking and making people feel like they're in their 20s and 30s again and prolonging people's lives to stay active and stay more active in the yachting world and everything else they're wanting to do, but they're slowing down because of aging, which is a natural process. But learning of making you feel better and prolonging that youth feeling is a hot topic and it's everywhere. So we're kind of one of the only concierge services that does traditional Western medicine. And I'm really big on finding the root cause and doing functional medicine too. And I've gotten so good with telemedicine during COVID. I was one of the first, what do they call it? The first edition of the iPad came out. I was like, "Hey, your kid has pink eye. I don't need to see him in person. Just let's FaceTime. And I could see the goop coming out of it. And I'm already feeling like I'm itching my eye. It's so contagious. Stay home. I'll call in the medicine. So I was doing telemedicine 3 years before COVID came. And unfortunately or fortunately, COVID put telemedicine as a thing. And now I use it all the time to talk to my clients. I have private jets that are on yachts, that are on boats. They call us and I give them really good medical advice and it's personalized. And that's what sets us apart because a lot of pilots even told me they call the general line, they like ground a plane, do this, or just give them very general, safe advice. It's good advice, but
Yeah.
so much nicer when your doctor knows your captain, your crew, your flight attendant, knows your shipman, knows everyone, knows your chef,
Yeah.
knows their medical problems. So that's what I do. And that's what I'm really excited to tell the world. And it was just by luck that I met you guys that I was there. I got to go on a yacht a year before COVID. We went to Formula One and the Cannes Film Festival with a family that wanted me to be on the boat. And it was great. I took care of her whole family. She had a daughter that was also pregnant, and they just wanted someone there to help out. And I did IVs for them and took care of a couple little like injuries. One of them got hurt on a foil board. And the nice thing is I'm a big waterman. So instead of just sitting there as a doctor watching them, I kind of did water safety. I helped out. I'm really good at stand up. I'm good at kite surfing. So it's kind of nice to have a water safety person with you. And I learned a lot of those skills when I've been the island doctor at Tavarua and Nomotu in Fiji, where they give you a little tree house. You stay there and take care of all their guests, but get to be in the water with them to make sure they're safe as well. So the two have kind
Okay.
of come together and it's been super fun. And I'm excited to share it with you guys.
Yeah, and especially as you just pointed out, boaters are constantly managing a different type of risk, usually involving something like, weather and gear, um, crew, navigation elements play a big part, and you kind of speaking that language, super helpful. The other thing too to point out about this population is sailors and boaters in general, they're a special breed, right?
Yeah.
They're physically active for the most part, often remote. Some of them, are on the high net worth individual side of the population, and there's fewer of them, but you can pretty much help everyone across the board with their unique needs remotely, which is, first of all, absolutely awesome, which is why we invited you here. But the second component of that personality of boaters is sometimes they're a little bit cavalier about risk and they're frequently away from traditional care. So
Yeah.
now that we have all of this perfect recipe for, disaster potentially, it's even easier for you to come in and say, listen, I can be there of support. However, you will not get heliported to the boat. So,
Yeah.
how do you provide this care remotely? Is going to be one of the questions we're going to answer. But first, perhaps let's unpack from your experience what are the most common injuries and issues that you see in boaters, cruisers so far?
Yeah. So these are very good points that you bring up. I mean, one thing is to be on a small vessel versus a big yacht, right? So just if you're kind of like running your own boat and working on it, which a lot of people do, right? Like there's exhaustion, there's simple things, there's just like a back spasm, your back going out, right? That could
Uh-huh.
be debilitating. When you can't get out of bed, you lose a crew member, especially if you're operating at your own it, right? The basic things of just dehydration, right? Sunburns, seasickness. Look, you're not going to buy a boat if you get seasick, right? Like these people are experienced, but even the best of them
It can
get sick.
happen.
It can
Listen,
happen.
the conditions will make it happen for you.
I
Eh,
mean, we were supposed to do this 2 weeks ago, and I was
Mhm.
deathly sick. Like I haven't gotten sick in like 2 years, knock on wood. But of course, it happens, and I forget how debilitating. It took me like 5 days for my brain to start, working properly. I was so fatigued. So I actually called Modo. I got an IV drip from my own team. And it's the second time
Okay.
I've used my own services. And I almost want to write myself a review and be like, this company is great. They came to me. Another time was I had a toe infection from a reef cut that I didn't clean too well because it was my birthday and I was hosting an event. I ignored my own cut like any good patient would, and I'm probably one of the worst patients. So that's why I'm very understanding when my patients like I forgot to take the medicine. And I make everything very convenient. Like giving someone a medicine 4 times a day is a pain in the butt. Twice
Uh-huh.
a day if you're lucky if they take it. So
Uh-huh.
I kind of really manage my care and I always put myself in their shoes or my family members. Like I treat everybody the same way I would treat my mom or siblings or cousins. And I go, what's cost effective? What's reality versus what a textbook says? Because medicine's an art and every person is different. Every art piece can be different if two painters paint it. It's not the same. So generalized medicine and studies are done for the mass public. But if you're an individual and you're unique and you're sensitive to one thing or another, that's why the personalized care and concierge comes in handy. We're not rushed in 10 minutes with like an HMO office meeting. I get to really talk to you and tailor what you need. Uh,
Absolutely. And I wanted to add too, you were speaking about, owner operators, small crews.
yeah,
Oftentimes, long distance cruising boats, two people, maybe three people, a family.
yeah,
Sometimes, most times, if the primary, driver slash captain slash boat handler is incapacitated, that's a huge risk. There's
oh,
high vulnerability in those situations, and access to care cannot wait. I actually
yeah,
personally had this experience. We were returning our sailboat from a race, sailing back from Bermuda to Annapolis. My husband was extremely ill. It was not seasickness. He
yeah,
couldn't really explain what it was. And we had access to actually a doctor who had covered the race, and we used a sat phone to contact the doctor, get some reassurance, did the best we could. Uh, he was feeling so bad that had we been in Coast Guard range, I think we may have made the call. We
yeah.
were in the middle of the ocean. We didn't have a
Wow.
choice. So,
Yeah.
to your point, thank you for bringing
Yeah.
this awareness to your service.
I mean, there's decisions like you guys have to make real time. When you see a weather pattern come up, or swells or the winds, you make a decision to go,
Yeah.
and you have the experience for that. But to make that call, they're like, okay, what do I do? Someone's sick. Do I go in or do I not? And that shouldn't be your responsibility. Now that there's Starlink and there's Wi-Fi, like people coming
Sure.
from Africa on safari, like I scratch my eye. What do I do? I'm like, go to that medical bag I gave you. Use this
Uh-huh.
medicine. And they're like the ones that are like, I never get sick and they jinx themselves maybe, but it comes in handy and being able to call someone. So whether it's dehydration or your back goes out or just even jet lag or basic things like that, like I have remedies for all of that. And it could just be the incidental food poisoning, gastroenteritis, or some virus. Like, look what's happening on real time right now as we speak. This next maybe pandemic, this hantavirus coming out. Like, you don't know. And Honduras has been around for a while. I've seen maybe 2 cases of it in 20 years. We had a kid that cleaned out a cabin and we figured it out by playing Dr. House because it's such a variable thing. It's not a common disease to pick up. But
Uh-huh.
he
Uh-huh.
had, encephalitis. He was confused. And based on his labs, we reviewed it. We're like, yep, he cleaned this attic in a barn, had a bunch of rat poop, and that's how he got it. And I've seen a
Wow.
case of it. So it's just being able to call and say, no, it sounds like the flu. Why don't you use a flu swab? We're not worried about hantavirus. At least you navigate, you do the differential diagnosis. Like, hey, my belly hurts. You don't know where your appendix is. You haven't seen enough appendicitis. I've seen probably 500 cases of it. I could gauge you and tell you, I think it's your appendix. You need to get off the boat.
Uh-huh.
Or
Uh-huh.
meanwhile, I have some antibiotics to kind of help cool it off. And I could, I've done so much. I've even seen a guy dislocate his shoulder, a windsurfer, right? And they're out away, and for sure, standard of care is get an X-ray, do procedural sedation, reduce it. You have to go to an ER unless you're like super experienced, like in that movie where he dislocates his shoulder and gets angry and hits the wall, it pops in. But that's a movie. What's his name? The guy from Braveheart.
Terrible at movies. Mel Gibson?
What's that?
Who is it? Mel Gibson?
Mel Gibson. Thank you. Yes, there's a movie where he's in a straitjacket. He pops his shoulder out, puts it in the 80s or 90s. But
And another thing as well to add is the community of boaters we're speaking about tend to be older. In fact, in the US alone, half of boat owners today are over 60. So
really,
now
that,
that I've shared this with you, and we've had a conversation with a offshore safety specialist who's not a doctor, he's more concerned with offshore safety in general, from equipment and crew preparedness in particular. And his recommendation was before an offshore passage,
mm,
get anyone over the age of 40 to do a cardiac test
Yeah.
I think it's called cardiac stress test
Yeah, correct.
beforehand.
That's of course. So that's not a bad recommendation. How useful a stress test? It doesn't really tell you the amount of disease you have. It just tells you your exercise tolerance with your heart, and if
Okay.
you have narrowing, and it's really there to capture if you're having angina, like a narrowing of a blood vessel, where you have chest pain. So that's a little bit, I won't say old school. It's still standard of care. We do it, but now there's modern technology. There's CT scans that have minimal radiation, almost a couple X-rays. You could take it's called a calcium, a cardiac score. You could see how much calcium you have in your blood vessels,
Oh,
right?
wow.
And
That's
your
way
heart.
advanced.
How
Okay.
much narrowing. And then there's even a better one where you could do it with some IV contrast that looks at your heart. So those are like the great things I'm doing more for longevity and screening. I do like a blood test that screens for like 50 cancers. So as you retire and you're turning 60 and you want to sail and go away, one problem
Mhm.
I realized
Mhm.
is I realized it during the pandemic when people became nomads, just working in different cities, doing work on a computer, they couldn't get a primary care doctor. One, a lot of people weren't taking new patients. They wouldn't talk to you if you had a fever. It was crazy. I'm like, how are you a pediatrician and not seeing a kid that has a fever? Oh, it could be COVID. What? I don't know. Maybe I'm an ER doc. I jump in. I diagnosed the first case of COVID in, I think, Hawaii, at least in Maui. And I did it. And half the time I was just like, that's what I do. I'm an ER doc. I got to help, while a
Mhm.
lot of
Mhm.
people
Mhm.
stayed home and garden and watched Netflix and chilled for a year. I was running around seeing the worst of the worst and helping people.
Yeah.
And I learned a lot during those years because nobody wanted to go to the hospital. You go to the hospital, you don't make it out, or family can't visit. I started treating urosepsis at home, bad cellulitis, bad pneumonias, because the people didn't want to go to the hospital and get COVID. Even though they didn't have COVID, that's something else. They don't want to risk getting COVID, which I totally understood. So it made me feel really comfortable, push my level of home care, where I've made some of the rooms in the IC at the Four Seasons comparable almost to an ICU. A nurse and me and a monitor, and a guy's like, I'm 80. I've had bladder cancer. I'm Irish. I'm here. I rented a whole third floor. I'm not leaving. And he had his private chef, and he's like, God damn it, I'm gonna have my whiskey. I'm turning 80. I'm like, you know what, sir? You've had chemo, radiation, whatever it is. And I allowed him to have like one cocktail at night. And and you had good food. And I realized the love and the support is healing from family, as opposed to being in a hospital, getting woken up by a random nurse every 4 hours to check your blood pressure. I've had a paramedic, a friend of mine, get admitted to the hospital for a reef infection. He almost went septic. He goes, the only difference from this hospital and prison is I'm allowed to walk out of this hospital. He's like, I
Not a
felt
great
like prison.
experience.
I was
No.
on their schedule. The food was horrible. My roommate kept coughing. He's like, he felt like he was in prison. So what I kind of bring is just access to a good team. And people are going to ask, well, how do you take care of all these people? I take care of my clients for sure. And I have a whole team of other doctors and PAs and NPs that I've trained that could answer a phone call for a UTI, a pneumonia, a strep throat, and all those things when you're remote to kind of give you ideas. And they always call me. I'm always available and I help out. But
So there is, I was gonna ask, there's a little bit of triage to kind of
absolutely.
take the
Uh,
low level emergencies first, and then, obviously bring a doctor on the phone or
yeah.
on the
Can I
and
just
actually, we're gonna get into that pre-departure medical planning, and we have a show and tell section in the show, so this is it. Um,
yes.
Tell us, actually, show us what every crew should have in their medical kit
So
before they
first
leave
is
the
there's
dock.
some medications that you people I know this a lot of people come to Hawaii and like, I need a refill of this. It's a controlled substance, even Ambien, even Adderall,
Mhm.
even and Vicodin you take for your chronic pain after a surgery or whatnot. You can't just hop to different states and get it. The DEA has gone so strict, so hard. You can't walk into a random doctor's office or an urgent care and ask for controlled meds. They'll give you one or two. Now, if you're sailing, you're going somewhere, how do you ask for a lot? Like a normal doctor might feel uncomfortable, but if you're dealing with a concierge doctor, like I understand you needs 3 months supply, I could help out or call in advance. So right now, what we're talking about, this sailing event that's coming up, I recommend anybody on that trip that is more complicated, higher risk for their medical needs, has there's so many things. Even if they're diabetic, like I could work with them and having like glucose monitors I could put on them, and I could monitor their blood sugars while they're out at sea, and just keep in touch with them. I have a dietitian that helps out with that portion too. One I recommend is just doing a consult with us privately, one on one, and getting your personalized meds. If you're one person that always gets a yeast infection, a bladder infection, someone that always is prone to pink eye or a sty, or
Mm,
just, you need your own personalized ear drops, call us for a consult and we'll take an hour and
mhm,
talk. We'll
mhm,
order the meds to any pharmacy that you're at, and you could pick it up and your insurance should cover those meds. As far as the boat, I think every boat should have some medical safety stuff more than some band-aids and some Tums and some, meclizine, right? Or Benadryl. You should have an EpiPen. You should have some antibiotics for a reef cut. You should start topical antibiotics. I have stuff to like show you how to suture. A good sailorman will pretty much do anything. And I even FaceTime one of them to teach them how to suture a cut. But now I have Dermabond, which is the medical grade like glue to close your wound. So what I do is I basically have two different levels. I'll show you. This one little medical bag is just like a carry-on. It comes with a note saying you're allowed to travel with this. It's never a problem. It's
mhm.
super light. It's maybe less than 5 pounds, but
Okay.
every organized in here for topical creams, stuff for wound care, antibiotics, blood pressure cuff, pulse ox. And then even now, a lot of times I've had hard times, treating ears over the phone because I want to look. What
Mhm.
if it's earwax? I don't want to give you ear drops. It's just going to make it worse. What if it's an ear infection in the canal? Oral
Mhm.
antibiotics don't get into the cartilage of the ear wall. So you're just taking oral antibiotics for nothing. So
Okay.
now there's a camera. Simple. You just charge it.
Wow.
I didn't open it. It's in here. You could take pictures of your ear and send it to me, and I'll tell you, yeah, go ahead and take the amoxicillin in here or the Z.
Amazing.
And then this I sell as just an annual prescription membership that stays on your boat. And then this is inside it. You open it, you have my direct cell phone to call, or you call the office and you're like, hey, I'm on this vessel, I'm on this yacht, I'm on this private jet. We look them up in our system, prepaid, doesn't matter who they are, as long as they're on that boat and they have access to this and it's locked up, they unlock it, they find this, we go right here. Point to what hurts. Okay, your bladder hurts. Go over here. We got some bladder medication. And everything is just teed up and color coded so you know. So this is way more. I've been on so many planes. I've been on private jets. I was on Air Rome to Italy. I had to help this guy. I looked at their medical kit. I'm like, this is horrible. So I
If it's not expired too.
yeah, exactly. I switched to my own bag and I was like, wow, my stuff is way more advanced. So these are all prescriptions. These are
Right.
prescription antibiotics. And people are like, oh, you're going to give those out to people? I'm like, what are they going to do? Abuse a Z pack? Like, there's really, for the private person, if they need a Valium to get on a plane, if they get a little anxiety on that boat,
Mhm.
I'll even talk to them. Sailors and most people, some of them like to drink. Let's say something happens and they go into alcohol withdrawal, right? Those things can be devastating, going to
Yeah.
DTs and seizures. So I'll have some meds to calm the nerves and get you in. I also, I don't advertise it much, but I'm getting my board certification in addiction medicine. So anyone that's worried about boating and going away and worried about like alcohol withdrawal or opiate withdrawal, like I'm
Sure.
very capable of helping. I've managed at least 2 to 3 rehab centers as our medical directors. And then, everybody talks about AEDs. They're usually these big things at the airport. Like, who wants to carry one? So look,
Nobody. Show
I
me.
just got this year. So I
Oh,
just
wow.
this company, and this is how big it is. It fits in this. And then the coolest thing is it just stays charged with a USB port. You
There
don't
you
have
go.
to worry for a plug, and it's this big. This thing can save your life. It has a pediatric and an adult pad. And then with the bag, this is an add-on. We give you full training. And once a year, I go, hey, it's time to change your pads. But now you don't have to change your battery. So this saves money because all you do is just charge it with the USB. So it's really great. And
Amazing.
and I know the battery is good. And then for the more advanced people, like when I travel, I use my Pelican one. And this is the one I give to some captains on planes and yachts. It's a Pelican case, super sturdy. And this is the one that it has way more than
The
this is mine.
run-of-the-mill medication. Mhm.
It's a little bit more disorganized, but it's mine. I have stuff for IV starts. Every now and then there'll always be a nurse or paramedic that could help you.
Mhm.
All nausea meds. It has injectable meds. It's not that hard to drop a medicine and give it to you. I'll FaceTime and show you. It has a thermometer. It has pulse ox. It has all your meds. And the nice thing about this kit is I have medical grade COVID tests, flu tests, RSV tests, and strep throat. And again, this is pioneered. If you have kids, I do oral medicine for kids that are liquid. It's just powder. You just add water and mix it. Like you literally become my medical assistant. And with this, I kid you not, I could operate my urgent care for a day or two. I have enough supplies in here to see like
Wow.
multiple patients throughout the day and use the antibiotics in there for, common things like a
Mhm.
beast. Like one captain was telling me right now, he got stung by a bee and he called their marine line and they said, go ahead, use the epi. But he's like, the ambulance was 45 minutes away. I forgot where they were, somewhere in the Caribbean. I go, well, why don't you do it again? He's like, well, the guy said you can only do it once and we're waiting. He goes, the symptoms came back. I go, epi lasts about 15 or 30 minutes. It's very short lived. He goes, when I got into the ER doctor's like, why don't you do it again? Like, exactly. ER doctors know. But the guy was just a normal doc in the box that picks up the marine line and gives you the
Right.
basic advice. So he's like, man, I wish I knew you then. And then he also told me the missus that runs their boat with him, their owners, just unfortunately got diagnosed with a type of cancer that needs blood tests done like every 2 days. She's doing some intense
Oh,
chemo. So she'll
wow.
only be 2 hours away from
Right.
Miami
Mhm.
and on a board going in and out like this. So I was like, dude, that machine to do the blood test is $600. You just need a nurse. I'll put a nurse on that yacht and extend. She could go out for a 12-hour trip further away. So my goal is to like let people know about this and just say,
Sure.
hey, I'm 80. I can't go on a yacht anymore. I can't go on a sailboat. Not true. Just take the medical team with you. It's simple. And the technology is there. At least have the medical bag and let us know where you're going. So it's on our radar. But for any boating guy, any boat that runs a rental, a tour guide, fisherman, I
Mhm.
could better remove fish hooks. Like the common stuff happens, right? It's the trip and fall, it's the ankle injury, it's you slipping on the deck, it's the
Yeah.
head injury. Google says, go to the ER. You call ER. She's like, I can't give you
Yeah.
advice.
Mm-mm.
So do you make that decision as a captain to keep sailing and someone has a head bleed, or do you call an ER doctor that sees head trauma daily at work and knows when to do a CT scan and when not to? So
Yeah.
it gives you, reassurance, gives you less liability. So I think it's a no-brainer to have access to a good team.
I think if I recall correctly, during the safety at sea training that is dispensed by U.S.
Yep.
Sailing, it's very intense course with how to climb on a life raft. So you do an in pool like trial. They have
Right.
lectures, and they had mentioned that two of the I guess sources of most common medical emergencies on yachts relate to pregnancy, and number two, dental. What can we
Right.
do about dental, if anything? What do we do?
Yeah. So antibiotics, antibiotics, antibiotics. That's the
Got it.
best thing to cool it off.
And
And
get off the boat.
yeah, oh, yeah, and pain control, pain control. And look,
Okay.
again, I have dealt with surfers that have been, I've been traveling to Indonesia, going on boat trips that are literally 12 hours away from land and finding these remote islands and trying to find the most remote place to surf because it's uncrowded, right? And I've seen people get hurt there, and I was just like, wow, I can't believe how remote we are. I took care of a lot of surfers there,
Sure.
and guys like, thank God you're here, doc, because in the past I've stitched myself using fishing line. I'm like, what? Like these guys are cowboys, and they just want to surf, and they'll do what they need to stay in the water. But with the stuff you're talking about with pregnancy, I do have a portable ultrasound. So for anybody that wants one, I could order one. They're a couple grand, but it's a nice tool to have. It connects to any iPhone or iPad. You could literally put
Really?
it on and just show me. So I use it all the time. Maui's a huge place for baby moons, right? 6 months pregnant, they take a little week vacation and they come out. I don't feel the baby, or I'm spotting. So do
Wow.
we go to the ER? Do we do this? And it's their first time baby and they're concerned. I just go with the ultrasound. I call it the magic wand. I turn it on, give it to them. It's really, I use that ultrasound more than a stethoscope, right? It just depends when you trained. And at UCLA, we were on the frontiers using ultrasound, and I did a mini fellowship in it. So I'll use it to look for gallstones, kidney stones. I use it to look for, ovarian cyst. You could, if someone's like having pain and they didn't know they're pregnant, you got to make sure they don't have an ectopic pregnancy. That's life threatening. But if you see a little fetus, a little peanut, you're like, the chances of having twins and one being ectopic is like 1 in a million. So I think you're fine. Keep sailing. That's the nice thing about it. And I did deliver a baby on that show, White Lotus, but in real life, I've done it before at least 50 times. So
Not
if
just on television? Got it.
yeah, exactly. If someone's at least, baby's viable after about, God, it depends what city you're in, 24, 26, but usually if you're like 7 months, 8 months and you care to go out to sea, you want to be close enough that if you're starting to have contractions to come in, I don't advise someone to be out. But God, I know someone that said three of their kids were blown out on a boat. Like there's some people that are very cavalier and will do that. Do I want that responsibility to be there? So I'll deliver your kid at sea? Probably not. And I wouldn't be the best for that. But in an emergency, can I deliver a baby? Yes. And I've done it plenty of times at cars where people don't even make it to triage. They're popping their kid out in the car, especially if it's like the third or fourth kid. But the hard stuff that to go back for too, I don't have one with me, but a portable EKG. So when you're having
Sure.
chest pain, it's really hard to tell if it's really cardiac, is it indigestion, is it angina, or is it really an MI? Look, not all people show up with the classic textbook that an elephant's on their face and there's sweat on the guy's chest and he's like, I can't breathe. I think I'm having a heart attack. Those are
Right.
slam dunk, right? The
Right.
ones that are like, oh man, I was like cleaning the deck. I started feeling this pain. I think it's my shoulder. But I started doing it, and the pain came back. I'm like, no, it sounds like it's exertional. I think you're having angina. So if you do an EKG and it's not rocket science, everything's on YouTube. And with FaceTime, I could tell you put lead one here, lead two, lead three, four, five, and six, plug it in, put one here, put one on your feet, and hold still and have your friend hit start. And then you show me a picture of it. I could tell you, yeah, you're having EKG changes that are very concerning. You're having like ST
Got it.
depressions here. Take that aspirin, take that nitro. If your blood pressure is good, let's get you into C. And that's the nice thing is the concierge white touch or high glove, whatever you want to call it, is I would coordinate wherever you're going to take that boat in to make sure there's an ambulance, make sure there's another concierge doctor to take over you, or at the minimum, call that ER and give them a heads up. Hey, I have a patient
Oh,
with
you
this.
will do that?
Yeah, absolutely.
Sorry, I was gonna ask if, you've actually had to intervene yourself, like, in an emergency for a high-profile client,
Yeah.
you had to go there.
Yeah, absolutely. We had a super VIP that is out in Hawaii that needed their kid evacuated. And they literally called my office, and my office was like, I think he's a little busy today. And then when I found out who it was and I looked at the schedule, everyone's like my friend. I'm like, tell my friends I'm going with this person. They'll understand. Your schedule. Yeah. So I've flown out, and usually from Hawaii or LA, where I usually reside, I could be pretty much anywhere in the States in 6 to 12 to 24 hours if really needed. And I usually like to do things preventative. I always say an ounce of prevention is worth a pound of cure. So
Sure.
if you're having a tummy ache, you're having an earache, let's not sail for a week. Let's get it taken care of. Oh, I already tried. I called the ENT doctor. They're booked for 6 weeks. Let me handle. So this concierge world now, like there's favors I'll do for other docs when they're like, hey, I'm sending this guy into the ER. I'm so sorry. My office is closed. I just operated on him. Can you check him out, Raz? Absolutely. And now I call it. I have a visitor that needs your special ear device. I don't carry one. Your office says you're booked for 4 weeks. He goes, lunchtime, 12:30. Done. Everyone's happy. So it's really nice. I had a client right now that was on a plane that was flying to Europe, was sick. For some reason, he just didn't want to go to a doctor in Spain. I don't know what his reason was with Spain. He goes, I want to go to London, find me someone. I called, and there's this other doctor I've collaborated with. He's like, mate, I'll meet him in his hotel or the runway. Just tell me when his plane's landing. And it was so
Yeah.
reassuring to have another guy that does concierge and understands the kind of service. And he met the guy on the runway, took care of him, and then he took off and went on his trip. So we've done all kinds of stuff. And like I said earlier, too, just by video, I had the son reduce the dad's shoulder that was dislocated. It literally showed him a link, a medical link to watch. They had some medicine. I gave him a
Mhm.
Valium and pain
Mhm.
medicine to help him relax. And
Sure.
then within 30 minutes, he on video, I told him what to do and pull, and I had someone else pull, and I even saw it pop in. I was like, that was impressive. Like that, I made sure to say I reduced the shoulder by telling a guy that knows nothing medically because time was an essence. You don't want to leave the arm dislocated or nerve and artery injury. So you give it a E for effort, a college effort, and it works. And they kept going. So I'm just like getting into all this, like cool things with technology and then we have and that portable EKG, portable ultrasound, and this bag, like you are set for, anything like a MASH unit, and I've done event medicine before. I've been the medical director at big events. I did Coachella 3 years. I did Stagecoach. So I'm used to like overdoses, dehydration, and just really bad asthma and people having allergic reactions out in big crowds. It's really dangerous. So I've operated out of a big medical tent that if I don't know if you remember, you're too young, but MASH, the show, like people would, it's like a MASH unit, like, wow, look at this. We had an ice bath for people that were too hot and heat exhaustion, and we have IV drips. But now what I love is just making that yachting and boating for those high end like weeks when they're like in Monaco and they're watching Formula One. They're partying, they're watching events, 18 hours out of there, they're sleeping 5, 6 hours, if that. So that's the fun stuff I really like. And with a lot of my clients, they sign up for the medical stuff, but they're like, how do I feel better in this? And I educate them about peptides and just biohacking and just functional medicine stuff. So it's been a really fun journey. And having the experience as a boating person, I wish I had more time to get on a boat and operate and do things, but just that experience I had as a marine biologist, getting to diving and knowing about injuries and jellyfish stings and sea urchin injuries and all those things that could kind of ruin your trip and telling you what to do. It's just super nice, especially if you have guests and other people, to decrease your liability and make their stay on your boat a more pleasant, safer one.
One question then that comes to mind, Dr. Rez, what is the service that's most appropriate, most relevant for the average boater? Let's say, a family cruising a 50 to 60-foot yacht, or somebody that does a longer passage on maybe a larger boat, but nothing extravagant, nothing in the 100-foot super yacht category, where perhaps budget is a little bit more of a concern. What is the right approach to getting personalized care? Can you give us some price points and what would be appropriate for them?
Absolutely. So we have concierge memberships that are individualized or family planned, right?
Okay.
So I think our kids are very reasonable. Our kids are like 1,200 for the whole year, unlimited calls, unlimited questions about what happens to a kid under 18. Our adult rates are somewhere around 3,600, and then older adults, I think, become like 6 grand.
Okay.
But again, I'm very reasonable. I'll see what medical problems you have, and
Sure.
we'll give you a proposal for the family, and we discount a little bit as other people come on because it
Okay.
simplifies it, and I'm reasonable. If one person's sick, the other one has the same, so we kind of do that. Right now, we'll do like an a la carte visit, which is just $299 for a week retainer. If you want to just call and get some prescriptions for your travel, and we'll answer
Okay.
your calls on your trip. We did that for a lady that was sailing to Fiji for 2 weeks. So she paid us a little retainer to be available and give her some meds for medical problems she sometimes
Okay. Very
has.
good.
But I highly recommend just a medical bag because then this would just service anyone on that boat.
Sure.
Now, I guess if you carried it with you and you're the owner, I would still help you.
Uh-huh.
But this is just, it starts out at 1,500 for the whole year.
Okay.
And includes the meds I discussed. The AED is obviously more, and I think it comes out
Sure.
to maybe 4,500 or 5 grand. I
But the
forget.
point is you can customize the package and what's in the
Yes.
bag for the client.
The
Okay. For the
client
patient.
and their family. So I highly
Okay.
recommend just a basic travel one, and you could take it anywhere, but just leaving it on your boat is key. And then I have the more advanced, upgraded ones like this Pelican. This is the medium sized one. There's even a super sized one, depending how big your
Okay.
crew is. If you have a 30 crew, I give you the bigger one. You got a plane or a boat with 6, 8 people, I do that one. So that's what I recommend. You guys could always
Sure.
call. It's free for a consult and just to talk to see if we're a good fit for each other. And the nice
Great.
thing is while you're sailing and stuff, what concierge medicine is me doing my due diligence. I become the main orchestrator. I become your doctor for a lot of your stuff. I go, listen, it's time for you to get a mammogram. So let's come back to shore at some point this year and get a mammogram because you don't want to end up with breast cancer. And hey, sir, you're due for a colonoscopy. You said your brother had colon cancer at 50. You definitely should get one in your 40s. So let's schedule you one. And that's the nice thing. And you get a patient care coordinator, a PCC assigned to you. So you always call me, can't get a hold of me, you call the patient care coordinator, which is super nice. And you're like, hey, I twisted my ankle, I want an x-ray, or my back went out, I want an MRI. And we do it all for you, and we'll fight, and call your insurance and get it pre-authorized and pre-approved. Or a lot of times cash is king with radiology centers. You pay, you just get to go do your study the same day because they don't have to deal with the billing and things like that. And then should you want to talk about longevity labs and supplements and other things, we add that on and I don't charge more for that. So it's kind of a game changer, and the ability to just set up a mobile person to draw your blood. I could have someone meet you at your dock or your home or your office to draw your labs. You don't have to do much because going to the doctor is not fun. And I've been on that side, parking, sitting next to sick people. The doctor's always running late. I get it. I've been on both ends. But if you're able to have the luxury to have the medical team come to you, it's a no brainer for me, And like I say, at this point, some people have taught me, like, what is your wealth if you don't have your health? And at some point, you realize it catches up to you, and you don't want to treat a disease when it hits full force. You want to be preventative and catch it.
I'm going to put the link to your company profile and contact info in the marine directory for Current Yachts below. So anyone who wants to learn more about your services and what you offer can find out more. Thanks again so much for sharing your insights with the full displacement community. Thank you, Dr. Rez,
Thank you.
and fair winds.